I'm Dr. Barry, licensed psychologist, and here we talk about true crime and psychology. Thank you so much for joining. Let's hop right into today's topic. Let's go.
Welcome. Let me know if you all can hear me in the chat by just putting a one. Today, we are going to be continuing our conversation about the Lindsay Clancy trial. This trial is very, very heavy. So please, if you are watching, make sure that you are taking care of your mental health. I cannot stress that enough. There are some chats that I've had to close just because the nature of the chat has just been, it's gotten a bit vicious because if you're going to disagree here, we try to disagree in a kind way. Feel free to say, in my opinion, from my experience, this is what I got from the testimony. People are, it's really common in situations like this where two people can look at the exact same evidence and get something completely different. And that's what I really wanted to talk about today. Battle of the experts. And the defense had their last expert. I think they saved their most impactful expert for last. There was another expert that was supposed to testify for them, and there's a bunch of speculation as to why that individual was not called. And I'm not going to get into the speculation on that. If anything is ever publicly stated, um, I think there might have been a news article, but if you go on Facebook or if you go in the Reddit chats or anything, people have some thoughts about why one of the defense experts wasn't called. I don't know, because a lot of you all have asked my thoughts on that. And anything I said would be pure speculation because Lindsay's defense hasn't said anything about it. And I haven't seen any statement from the judge or anything like that. And so with Dr. Resnick was a testified via Zoom. He had a medical, he had a medical thing come up recently, and he has been a psychiatrist for longer than many of us have been born. I wanted to go back and look to see if he had been. So the first DSM came out in like 1954 or 50s. It was in the 50s that DSM-1 came out, but he has been a practicing psychiatrist for a very long time, and he talks a lot about filicide, and he really a lot of what we know is based on a lot of the research he has done. He did evaluate Lindsay, and he did talk um, with collateral individuals with that. So he talked with not just Lindsay, but he talked with other people in her life. The defense wanted to see, I think, if they were going to put forward a not guilty by reason of insanity defense. And so they did have him meet with her about 4 months after the incident. And the state's expert wasn't able to meet with her until after the defense had filed their notice, until after all of these other things. Because I think the defense tried to kind of point out the fact that the state's expert was meeting with her, I think, 2 years after, versus their expert met with her about 4 months after. But and I don't even know if the I don't even know how anyone will kind of look at that. Um and let me see. I just want to make sure because yes, Dr. Resnick. He I thought his testimony came across very credible. He had a wealth of information, a wealth of knowledge. And he talked about the MMPI case scale. So I am a psychologist. I was trained on the MMPI. I do not personally give the MMPI. I'm not a fan of their true false. And I haven't given, so there have been changes to the MMPI. I just I like the personality assessment inventory, the PAI better. And so that's the one that I give. But just because somebody doesn't elevate the validity scales on the MMPI, it doesn't necessarily mean that they are being truthful about everything. So the MMPI has validity scales. So a lot of psychological testing, there are tests of validity. And so just because somebody doesn't elevate the case scale or certain validity scales, it doesn't necessarily mean that the person is being truthful or untruthful. And I wonder if the state is going to bring that out. It's okay if they don't. But I personally, when somebody's using like that one, the defense or the prosecution, when somebody is using that one scale to say, because of this scale, that means that the entire thing is that the person was being 100% truthful, that's not what that scale gets at. There are particular questions on the test that get at things like how open and honest is the person about admitting even just minor difficulties. So that so there are certain questions where a person, if they answer a particular way, it might signal that they were underreporting symptoms. There are certain questions that if somebody says yes to these, even in clinical cases, it's rare that somebody has a certain number. And so it might cause it to be interpreted with caution. And there are reasons why somebody can elevate certain validity scales. And so I like to nerd out about all of that. I also thought that because they got into malingering or faking symptoms, and just because, so there are additional tests of malingering besides the MMPI case scale, because there are specific tests that get at malingering. And I believe that Lindsay Clancy had a legit depression. Like I don't think that she was faking her mental health symptoms. I personally have questions about an individual after the fact saying that that one day that there was a command auditory voice that was so powerful, so overtook the individual that they acted in a certain way. Um, I don't know. So I'm still digesting all of this. I did feel like Dr. Resnick's testimony was really powerful. He also, I think, did a better job explaining bipolar 2. So I don't think anyone had said, I think we've talked about hypomania versus mania, but he did a really good job talking about bipolar 2. And he also talked about postpartum psychosis. But he did say that typically that does not happen 8 months later, that it's more typical with postpartum psychosis that it happens immediately following birth, that it would be rarer for it to happen later on. I kind of felt like it could have been the medications. So if there was a psychosis, if there was a negative reaction, that a part of it could have been the medications. I think the state does not believe that she was taking all of the medications as prescribed. And so the state kind of like, I feel like we're arguing over semantics at times, but it's very difficult. Uh Dr. Resnick did talk about the fact that Lindsay, there are 9 symptoms of a major depressive episode. And he said that she had 7 out of the 9 symptoms at the time of the incident, meaning that she was severely depressed. And he also admitted that she wasn't frank about how anguished and depressed she really was, particularly with her healthcare providers. I don't know what the jury will do with that. I like it when experts, when they just give the information, they give their opinion, and then it's all in the hands of the jury. Like they're not overly on the defense side and they're not overly on the state side. The expert is just presenting the information. And because there were times when I thought some of his testimony that it could have led the jurors down supporting the state's case. And there were times I thought his testimony strongly supported the defense as well. Um, he also talked about that day she was having a better day than other days, and that she was not psychotic until she had that command auditory hallucination. And I guess so it's my understanding of the testimony is that she's saying that voice happened after Patrick left. And is that possible? Yes, it is possible. It gives me pause. And I think the state did a good job coming back about how sometimes individuals will say that they're experiencing psychosis, particularly in the legal system, and maybe they aren't. All right. And so, and I've already talked about in the past that having a better day, and I think the state's expert did a better job explaining how sometimes when you're treating depression, you have to watch out for if a person gets an increase in energy and they're also having those strong thoughts. And I'm only talking about this case, and I only cover cases when there are things that we can learn and there are things that we can get from it, because I have gotten so many questions about if you have a loved one, if you know somebody that's struggling postpartum, that's struggling with severe depression, that is having significant thoughts, how can their family support them? How can other people support them? And the one thing that I will say is that if the person has a treating provider, often family can provide the provider with information, but the provider can't talk back to them unless there's a release of information. I have had times where people have been in a mental health crisis, and a family member came in with them to their appointment, even an adult, where an adult client brought a family member in with them into the appointment, and we were able to safety plan, we were able to discuss, we were able to talk about next steps and figure out what the next steps would be for a particular client. Um, and my shirt says stay. And because often people are hopeless when they're experiencing a significant mental health crisis. And as a provider, I want to instill hope. I want them to know that it's not this horrible day, this horrible moment, this horrible feeling, that it's not going to last forever. There is a podcast called 10% Better. No, 2%? Is it 10%? I think the podcast, I want to say it's 10%. 10%, because it's about being like 10% less depressed. And often I'll have my clients rate their depression 0 to 10, or rate their anxiety 0 to 10, because for a client that's severely depressed, a day of 6 out of 7 might be kind of a better day for them. And then if they're at a 9 out of 10, that's where, okay, we might be monitoring like things, I'm going to handle things with them a different way based on kind of how things are going. I'm seeing questions. Thank you. And thank you so much for putting the QQQ. So I'm going to go back up in the chat just to take a pause to look at questions. Do you think being such a strong expert advocate in postpartum depression would, I don't think I have the rest of that question, make him faster to diagnose postpartum psychosis if you have a clinic just for Lyme disease, for example? So, but Dr. Resnick, um, he doesn't testify for everybody. So I don't necessarily think that he would come to that opinion for every person. All right. Let me continue to look, because I know that there were some more questions that I missed. Please put QQQ or those question marks. That helps it flag in my system. How does it make sense by her account that she had no control over her body yet stopped to call Patrick back? Presuming he didn't come home and stop her, that shows clear thinking to me. And I think the state expert is also, even the fact of taking each child one at a time, that seems very methodical. and that seems planned. And based on the report she gave to the expert, because I think it was Dr. Mack that went over how she said how she said it happened. If I'm remembering correctly, and I might not be, but I feel like Dr. Mack was the one that kind of went through what she said of which child was the first, and how everything happened. All right. So creative chaosify, and I think it was Dr. Mack that brought in her current medications. Um, and they did mention that they are lower doses of those medications. Uh, and I'm not a psychiatrist, so I can't speak to the dosing. All right. Uh, welcome if to everybody. So, in psychosis, can a person remember, recall what they did? So, yes, it depends. So, in dissociation, if a person is completely disconnected, and so a severe dissociation can be a dissociative identity disorder. And that's where sometimes a person might have lapses and not remember what happened. It sounds like her dissociation was on the kind of mild to medium. It wasn't that severe. It wasn't me type thing. And so in general, so I can't speak for every case, for every situation, but yes. Can psychosis also occur in a depressive state? So, and even if it's bipolar or not, so even within major depression, there is major depression with psychotic features. So let's talk about the different diagnoses that can have psychotic features or psychosis as a part of it. So there is brief psychotic disorder. And that's where a person has one or two, like has one, normally it's like one brief, something happens and they have one episode of psychosis, but they're not remaining in a psychotic state for an extended period of time. There is um, major depression with psychotic features, where within a depressive episode, because there are modifiers severe, it can be severe. So we can start with mild. So there's mild, moderate, severe with or without psychosis. Within bipolar disorder, there can be severe depression because it's that depressive episode part. So the person is technically meeting criteria for major depression. I believe there can also be psychosis and mania. Um, so as a psychologist, I don't always have like, because sometimes you have to go back to the DSM. So psychosis within mania can be delusions, hallucinations, or paranoia. So, but that would normally be true mania, not hypomania. So let's see, psychosis and hypomania. Anytime I've seen it, it's always been with bipolar 1 with a manic episode. But typically, hypomania does not include psychosis. So, hypomania is that milder, shorter period of high energy, reduced need for sleep, elevated or irritable mood lasting at least 4 days. And but mania, it would be bipolar 1, is that severe high energy state lasting 7 days or less, if it requires a hospital stay. So you all ask great questions. And then schizophrenia. So that's not within the mood disorders. Schizophrenia is in a that's where an individual can and that's a break with reality. Normally, schizophrenia can come between older adolescence and young adulthood, but diagnoses that include, because I believe I hit them all. Yes, schizoaffective disorder is that mix of mood symptoms and schizophrenia, brief psychotic disorder, and there is also delusional disorder. So, where the person doesn't have the other symptoms of schizophrenia, but meets criteria for it's just delusional disorder. There is substance induced psychosis. There is also medical or neurological conditions like head injuries, brain tumors, strokes, certain diagnoses like neurodegenerative illnesses like Alzheimer's and Parkinson's, and then postpartum psychosis. All right. But postpartum psychosis is normally happening rapidly after childbirth because it's about the change that happened in the body and brain immediately following birth. And so that's where we'll see. We'll see. I know there are experts that definitely think that yes, she was experiencing postpartum psychosis. What it sounded like to me is there was this severe difficulty with going back to work, and then possibly that the medications worsened some of the symptoms and that things just cycled. It also sounded like she was trying to be the perfect mom and trying to give her kids the perfect life, trying to do things perfectly. I think that I wonder if the jury will go back and read that Facebook post about not being about that guilt, maybe even shame of not being able to parent her second and third child the same way that she did her first. And that is common. So nobody can parent child number 2 or 3 the same way as you parent child number 1. I said it. So I have a when I say I have a dark sense of humor, parenting is difficult. And I am not a perfect parent. Sometimes y'all will get to hear me talk with my child. I have had to apologize to my child for not understanding, responding to something as though it was a behavior when really there was something emotional going on. And then also for my second channel, where we're talking about neurodivergence, figuring out what certain signs of um, neurodivergent burnout looks like, and how with masking, how things can happen. And so nobody is a perfect parent, but often that first child is almost like your practice baby. Like but you do the bottle warmer, you do all the things. I think somebody said that in one of the comments where they said for the first baby, you do everything perfect. The second baby, the bottle falls on the ground and you like sterilize everything, like you're doing. And then by the third baby, you're just like, and you just like bottle falls on the ground and you're just like, it'll be okay. All right. Do you think Dr. Mack's behavior on the stand somewhat negate his testimony? So I wonder if the jury will find him less credible just because of some of that back and forth that happened. When the defense said that she called the 1-800 number and she was turned away, is that even legal? So they have certain standards, and um if a person, I wonder if the standard will change where a person could still be recommended for an evaluation, even if they don't have an immediate plan. Where it's like, I've been struggling with this. I've had constant these thoughts. These thoughts are getting stronger. I'm really concerned about my safety. Sometimes those hotlines are meant to be supportive, and it's meant to kind of provide somebody with tools, resources, online, some support to avoid a hospitalization. But it's really sad. Do you think Lindsay Clancy could have undiagnosed OCD prior to becoming a mother? Um, and a person could have obsessive personality traits. So often nurses like to have things a certain way. Often very successful people, sometimes they have like obsessive personality traits that might not meet criteria for a diagnosis because it's not getting in their way. But it seems like the anxiety got worse and worse. And with anxiety, I have a video here on the main channel talking about tips for anxiety. It's an older video, but it's still a good video where we talk about the difference between spinning worries. Because there's some worries where if I'm worried about like what if it rains? What if it rains if I can like pack an umbrella? But I can't control the weather. So there are some things that are going to be out of my control, and anxiety wants certainty and control. And the more I try to control it, the more I try to add more certainty, I'm actually doing anxiety. And sometimes I have to accept I can't control it. That I'm not a perfect parent and I don't have to be. That uh sometimes certain things will happen and it's okay. I think the expert cross by Reddington was brutal and his credibility was crushed. So we'll get to that a little bit later. All right. Is it possible psychosis voices could clear due to the fact she was not postpartum and properly medicated now? But it would be, but they never came back even before being on the correct medication. So it's strange to me personally. Now the thoughts of wanting to harm herself, that hasn't went away. So it sounds like even to this day she still struggles with wanting to be here and wanting to live. So even to this day it sounds like she's still on those precautions. She has to live with what she did for the rest of her life, um, even in the midst of whatever was going on with her. And that fact alone can kind of cause an individual to continue to struggle with thoughts toward themselves. So to me, Lindsay Clancy saying "go to God, baby" appears to negate her body being a puppet to a voice. Can you discuss that aspect? So I thought Dr. Mack's interpretation of it, I don't know that he could say what she meant by that statement. So Dr. Mack saying, like, because he gave his impression of what he thought it meant, and I was like, I don't know. Um, I am looking to hear from additional state experts on what they think about that before I give more of my thoughts. How can anyone know that it can be so fast? Is it based on what the patient says? It feels like answer is basically anything possible with psychosis. So nobody else knows what's going on in Lindsay's mind. So even all of these experts, everything, nobody else knows exactly what's happening. Um, so yeah. All right. And I am not a medical doctor because sometimes I've received questions about could the fact that she had that the spinal injury, how could that have affected potential psychosis? Now she still had severe depression, and if you go with the diagnosis of bipolar 2, she still had that diagnosis. And so the fact that the voice has never come back and there hasn't been other psychosis, that's where it makes me wonder, was it more intrusive thoughts about being a mom and trying to be the perfect mom and around the children? That's what it makes me think personally. Doesn't necessarily have to be she was in psychosis. Maybe it was a combo of meds and the baby crying, screaming could have triggered a break in reality. I don't know that the baby was crying. I think it was the fact that Patrick left. Her mom had just left a few days before. It could have been this hopelessness of not thinking that things would be better. And in general, it could have been that a person really got to a dark place, that altruistic, and I am going to get into that a little bit later, that altruistic doing that, I think that could play to the state and also to the defense. And in Massachusetts, they put it on the state to prove that she could conform her behavior to the law. It's not like other states that put it on the defense to prove that she couldn't. So in Massachusetts, they put it on the state to prove that she could. So I am looking to hear from more experts. From personal experience, I see psychosis in Lindsay Clancy. Would her psychosis from the time of the incident until when she went to the window be reasonable? So that's where the experts are going to talk about that. And Dr. Resnick did seem to think that that was his opinion. Okay. I don't understand how a doctor, even an expert, can diagnose a patient years after the illness. So it's based, so you're getting an understanding of what was going on in their mind back at that time. And so assessing somebody for how they were at the time of the incident, their mental state at the time of the crime, that is what forensic experts are trained to do. So you all are asking amazing questions, absolutely amazing questions. Please put QQQ or question marks. It just helps me see them. Um, and so I think the state's expert did a good job answering that question. In my experience on the anniversary, yes, anxiety was through the roof. Um, so I don't know how that works for Lindsay Clancy. And I also don't know that the nurses are charting every time that she's crying, every time that she's having a particular symptom. I don't know that all of that is being charted. Um, I've worked in a hospital and written chart notes. Now, you normally would document if a person was um, having, like, if they were showing signs of emotional distress, specifically in like a mental health hospital. But yeah, all right. Welcome to everyone. Thank you all so much for being here. There we go. Is it telling to you that these doctors cared so deeply for her? Not necessarily telling. I think that's what makes this situation more difficult. So I think Lindsay Clancy, she's a likable patient. She's a likable client versus Jodi Arias or individuals that Dr. Resnick might have turned down that maybe had some other signs and traits, some other presentations. I think it helps her case. So I was watching Courtroom Confidential right before this video, and Josh Ritter brought up the fact that I think it was Josh. It was because he was interviewing Lawyer Lee. Lawyer Lee is doing phenomenal recaps. If you want just like a brief lawyer's perspective, I've also been coming in and out of the Lawyer You Know's recaps too. But I'm almost positive it was Josh Ritter that mentioned if she had had a history of harming the children or of doing something like this, the fact that this caught everybody off guard, I think that's what makes this case more difficult. Was it professional for Dr. Mack to objectively ponder about the go to God statement? So he's there as an expert, so he does get to do that. Could her bipolar disorder have been activated by the medications? So there has been testimony to that. So SSRIs, because even Dr. Tufts, all of the psychiatrists testified that if you suspect bipolar disorder, SSRIs can be prescribed, but you do it with a mood stabilizer. And so, and she was on a mood stabilizer. So Seroquel is a antipsychotic, but it's also a mood stabilizer. It's an antipsychotic, often at higher at higher doses, but um, I find it totally plausible that ordering dinner and Pat going out was done in normalcy and the psychosis set in. So I am not giving my personal thoughts on this until I have more information. Do you think her severe spinal cord injury shocked her system? So that's where I'm not a medical doctor, so I can't speak to that. Um, Thoughts on two docs doing Lindsay Clancy interview together, considering it wasn't a team evaluation? Should it have been separate? So this was with Dr. Mack. So during Dr. Mack's cross examination, it came up that I wonder if it was a psychologist and a psychiatrist. So often to just so the person is having to tell the story multiple times, it is common for two experts to possibly interview somebody together at the same time so that the individual they're not having to ask the questions multiple times. They're not having to recant everything because it is more distressing on the individual to have them tell the story over and over. Often with So individuals that are the victims of intimate crime, they often try to have everybody that's just so that the person isn't having to tell their story over and over and over. They try to have like a team approach. And so it is common sometimes with even an expert evaluation if there are two professionals that are from different disciplines. So I wonder if the other expert is a psychologist and Dr. Mack is the psychiatrist, because I think the psychologist did psychological testing. We don't know this for sure because we don't know. I don't know for sure who that other expert is. I know people have done deep dives into the witness list and everything. I have not. From the testimony, do you see any overt signs of mania or hypomania? I haven't heard that from. So would I have diagnosed it? I would have needed more testing. And Lindsay herself didn't think that she had bipolar disorder. I thought it was interesting that Dr. Mack threw in there that Lindsay might still not think that she has bipolar disorder. And I don't know, like, I don't know if that's true. I don't know. Uh, but um, yeah. So there definitely was not signs of mania. And I saw and heard severe depression and severe anxiety. That's what I personally heard from the testimony of the mental health experts. The thing that makes this more complicated is that the mental health experts met with her virtually. I think there were some in-person sessions, but from the moment that she went to for evaluation at the emergency room, I would have done in-person sessions until she was stable. That's my own personal, like that is what I do. It is difficult. So telehealth is normally like this. Now you can, so I'm shaking my leg right now. I don't know. So you can kind of see, I think my shoulders going up and down, but you can't see what. So if I'm wringing my hands, you might see some movement, but you don't know what's happening. So if I'm monitoring somebody for safety, unless I've partnered with another professional. So in my state, we have something called intensive in-home therapy, and adults with Medicaid that have been hospitalized in the past, and then also children with Medicaid or Anthem private insurance, they possibly can be assessed for do they meet criteria for in-home therapy. There is also in-home crisis stabilization that's offered in my area in the state of Virginia. It is sad that sometimes people get the help they can afford, the treatment that's recommended, whatever they qualify for, and they might not always get the treatment that they need. Do you think her need for one-to-one is not because of her psychotic disorder? So I think it's her ongoing depression. So she's not currently psychotic. So nobody is saying that she's currently experiencing psychosis. Even Dr. Resnick said that like she has not heard a voice since then. I don't know when we get into is it an intrusive thought? The I don't know, like things get a little muddy after that. Could this have been drug-induced psychosis? So to my understanding on are you talking about the drug being the medication? If you're talking about it being the medication, um, I would defer to a psychiatrist. Somebody mentioned her medications were changed, and that might be the reason why. Um, I wonder if it's so. Is it telling to you that these doctors and red? Oh yeah, I answered that question. All right. I am catching up on the chat. Y'all are amazing. Could her extreme perfectionist personality when it comes to mothering her children could delusion, because you have to be careful to not pathologize something. Now, when it starts to interfere with a person's ability to go back to work, That's where I would have wanted more therapy. I also would have wanted a psychological evaluation if at all possible. And I'm glad that we're now talking about that gene testing that can sometimes be done. Now it can be expensive. I think it can be like $300 to $400. Insurance does not always cover it. It doesn't tell you exactly what medication would be good for you, but it can at least say based on your body chemistry, these are the ones we would recommend. These are the ones that we definitely would not recommend based on your genetic makeup. Also, if you have family members um, that have done well on different medications, sometimes having that can be helpful. My heart really goes out for individuals that are adopted and they don't know their family history, because sometimes a person, if they don't know that bipolar disorder or something like that runs in their family, that can make it more difficult. Wondering why the ADA is making such a big deal about no head injury. She is permanently injured. So, obviously, a serious head injury by the fall. So, I think the district attorney does not believe that it's almost like they're saying that she really wasn't trying to harm herself, when I think she did not intend to survive this. Um, I think the district attorney sees her in this very malicious, controlling, manipulative, because those were the words they used during opening statements. And I didn't see all of that. So that's where there were times I felt they played their hand too far to one side, where it's normal for a parent to have concerns of, am I ruining my children? And sometimes with depression or anxiety, that thought can get irrational. So there's a difference between irrational and delusional. So irrational, a person might realize, like, yeah, I'm researching this stuff way too much. I'm staying on these parenting sites way too much. A person can have intrusive thoughts and it not be psychosis. And so that's where I'm trying to see. And there can be obsessive thoughts and that are and intrusive thoughts that are more anxiety and obsessive versus psychosis. And so I need more information. I really do need more information. I wonder if Lindsay Clancy being sedated and intubated could have affected the psychosis. It's possible. Um Many times I've seen clients who were feeling like that have their best day. Yes. So I've mentioned this before, when they've made the decision. It's a big red flag to me that that day was her best day ever as a mental health professional, because I have researched individuals that have those chronic dark thoughts. And a big red flag is if all of a sudden the person gets hopeful and happy out of nowhere, and because there might be something that we all don't know about. um, would you continue to have a therapeutic relationship with a patient you'd forensically evaluated and were waiting to testify for? So please see my last video. I did a video where I talked about Dr. Zeisel and some of my thoughts about that. So please check out that last video. Also, if you had a longtime friend who was, okay, yeah, yeah. So make sure to check out my video on Dr. Zeisel. Hey, Lisa, do you think psychiatrists should rule out bipolar disorder before prescribing SSRIs? So I think her psychiatrist would say that they did. I think they would say that they did. And sometimes a person without bipolar disorder can have like stomach issues, can have an increase in insomnia and things like that, and it not be mania or hypomania. I have had where if there've been if a bunch of different medications have been tried and nothing's working, they then try to get a a psychological evaluation, that maybe something is being missed. It's my understanding that one of the doctors did give her a screening for, like, to look for mood symptoms, and she denied having excessive energy and all those things. And I think that's where Dr. Resnick would say that she was underreporting her symptoms, and that even now sometimes she can still underreport her symptoms. Defense witnesses seem to get much more information in their interviews than the state. So I didn't find that. I think they aren't saying all that she told her, that she told them. I thought Dr. Mack had a lot of information. That's how I saw it. Does insurance not cover in person? So insurance normally will cover in person. I've had some clients where telehealth was cheaper versus in person, or they didn't have a copay for telehealth, or but in person, in my experience, has always been covered. Yes. So in-home therapy and crisis intervention sounds amazing. I wish those were available. And like I said, in my state, adult in-home therapy is only for individuals with Medicaid that have a history of being hospitalized. And it's really more mental health skills building. It's not meant to be a crisis stabilization. Um, all righty. So regarding mania, what about her going into the MLM, high energy, cleaning out garage, decluttering? So sometimes I do that. I know that. But that might be my ADHD. So sometimes like I'll get energy to just do something. And also sometimes anxiety can cause, so it's not only and it would be hypomania and not mania. Um, but getting into the MLM could have been trying to find additional income for the family if she wasn't going to return to work. So I'm trying to look at both sides. Okay. So could those potentially be some signs of hypomania? It could be, but it also could just be that she's always kind of been concerned with her health. Um, the fact that her mom did Weight Watchers, other people probably didn't like catch on to that stuff, because some people get very they have thoughts about trying to get back to a healthy place. My doctor said, like, if you're running marathons before pregnancy, that during pregnancy you can still run a marathon. Like, there's nothing, but you shouldn't start trying to run marathons if you weren't a runner pre pregnancy. And so during my pregnancy, I continued to do Zumba, but I didn't do high impact during that first trimester, because the first trimester can be, there's a high risk. I was 34. I was 34 years old. I wasn't quite high risk, but my doctors treated me because I was 1 year away from 35. They treated me as though I was high risk pregnancy. It stinks that 35 is geriatric. We're not even going to go there. We're not going to go there today. Do you think her mom's work at Weight Watchers, yay, could have impacted her need for perfection? I just saw that question. So in general, I did not evaluate Lindsay Clancy. I cannot say what is or is not happening in her case. I wondered the same thing, but more about body image and need for perfection and some other things like that. Like it made me wonder about that. Um, so anxiety is different from hypomania or mania. So those are two completely separate things. Um, and that's where a thorough assessment would be needed to rule out everything. I have seen Dr. Yosef's uh, videos, and he has a clinic that helps people detox from medications. I don't think he's a big medication person in general. I have clients where medications like Zoloft have literally saved their lives. Those medications have saved their children. And so there are many people that tolerate medications like Zoloft just fine. And then there are some people that don't tolerate the medications well. And that's where having good communication with the doctor. Um, I've had people come into me for therapy or for a psychological assessment, and if with the medications they're having an increase in certain thoughts, I have them immediately reach out to their prescriber. Sometimes even like, hey, just go talk to the pharmacist. Like, go please go talk to somebody that can give you some advice on what you should do with your medication, because there's some things that are abnormal side effects that where medications should be immediately stopped. And so do, do, do. So that was more of a statement, I think, than a question. Yes. Dr. Yosef did seem to believe that her symptoms were drug induced. Let me see. MLM is multi-level marketing. So that was the beach body. It was beach body. Yeah, that's what MLM. What about Lindsay Clancy asking her mom if she could hear her thoughts? So, so there's a difference. So that's where I'm not, but that doesn't necessarily have to mean psychosis. It just depends. It just depends. Like sometimes a person can feel like their thoughts are so loud. They do feel like other people can hear them, but they know that they can't. Do you know what I mean? So the way he explained it, sometimes that's the reality testing versus automatically believing that of course everybody can hear my thoughts, everybody's thinking about me, everybody's, versus a more delusional statement where a person where the inside of their head is so loud they're just getting that validation, you can't hear my thoughts, right? And so I could see that going either way. All right. I'm really struggling with the psychosis only showing up. Yeah. um so I can't speak to what she experienced. I thought it was interesting that the state compared it with Andrea Yates, and how Andrea Yates was actively psychotic over a long period of time. She actively she was hospitalized multiple times. She attempted to not do the thing. And she actually attempted on herself twice before ultimately succumbing to the psychosis. And she was initially, I think she was convicted and she was granted a new trial and was found not guilty by reason of insanity. It was really interesting that the defense brought up that false Law and Order episode, because the Law and Order episode aired after Lindsay Clancy. Sorry, Andrea. Sorry, I said before, after Andrea Yates. If I said Lindsay Clancy, me and names. And so the Law and Order episode aired after Andrea Yates had done the act and not before, because one of the state experts seemed to allude to the fact that she got the idea from that episode, when actually the episode came out after she had. And so can you please elaborate on the different types of mania? So hypomania versus mania. Okay. So it's just different levels, it's not types. So hypomania versus mania. And so there are lots of different symptoms in the DSM-5 that can so just because a person has high energy, restless movement, just because they're fast talking, because I've had some clients with ADHD incorrectly, like where their psychiatrist thinks they're manic, but they're just really, really ADHD. Like they're really impulsive. They're just really, really ADHD, and they are not manic at all. But it can kind of present as this like flight of ideas, but it's more of in a ADHD way. And so mental health is complex, and it's not like, so somebody with the same diagnosis, or two people with the same diagnoses can present in completely different ways. And you have to do differential diagnoses, because is there something else that better fits these symptoms? So just because somebody's struggling with attention and focus, it doesn't mean that they have ADHD. So attention and focus can be a part, difficulty with concentration can be a part of depression. It can be a part of anxiety. It can be a part of a lot of different things. Just because a person stems does not necessarily mean that they have autism. That sometimes within ADHD, individuals can stem. And so like there's just, mental health is complex. I will leave that one there. Mental health is very, very complex. Okay. Very disrespectful that 35 is considered geriatric for pregnancy. But it is higher risk. And so I understand. There can be, they've done research, and yeah, there's things. Do you think her running the 5K 1 week after giving birth should have been a red flag? But is it really unusual if the person runs a lot? So sometimes a person wants to get back to normal. And so I know some people that are avid runners, and so I think there's a track and field star. What's her name? Oh my God. Y'all know me in names. Track and field star ran after because Al thank you, babe. Allison Felix. Allison Felix, like I think she was competing competitively right after. Like not like a week after, but like I'm sure she might have got back to training really quickly after. So I don't, and a 5K to me, like a 5K seems little. Like it's not like a marathon. Um, I don't know. So it is what it is. If you've been seeing a patient, would you prefer to see them in person, but they can only meet virtually temporarily? Would you refuse to have a virtual session with them? No. No. So if I was monitoring them for safety and I was strongly recommending in person, but I would document it on my end. uh it's not that I would refuse to see them, but normally um, I normally don't give people a choice, and they normally conform to that. What I mean by that is if I have a client that's been assessed at the ER, I tell them, "Hey, it's my policy. Immediately after our next session has to be in person." I've never had anyone fight me on that. Like normally they're like, "I get it." Like, and sometimes they want to come in person. In-person sessions feel different. I let new mothers bring their child with them to sessions. So I'm able to see how they're interacting with their child. I'm seeing how they're bonding with them. I've had clients that were having difficulties with sleep with their child, with all these things. And I've actually seen the child in session, and the child is very colicky. There's nothing anyone can do to kind of help the child. And so their child is just kind of colicky. And so sometimes encouraging them to talk with the pediatrician, because sometimes the child might be having acid reflux. Sometimes the child might be having, like, there might be something under why the child is crying so much. Sometimes the child might be having reactions to milk, or so dairy specifically. And so that's where sometimes the way I handle things isn't the way everybody does it. But I thought she sold Beachbody, and because it came up with that one doctor that she lost money trying to sell Beachbody. So I don't know. Yes. So, and even professionals. So the DSM. So nobody should use the DSM to try to diagnose somebody or somebody else in your life. Like a professional has to has to be there. But yeah, because there can be misdiagnoses. I know a lot of people, because of lack of resources, they might not be able to get an official diagnoses. But when I took advanced psychopathology in undergrad and also in graduate school, they warn us you're going to think you have everything. That within the DSM, there's this thing of, is it impairing your functioning? So a person can be very obsessive and like be very detail oriented, but it's not causing them issues at work. It's not causing them issues with their family. It's not causing any issues in their life. And so it wouldn't be diagnosed. And so, yeah. From a psychological standpoint, do you think someone would be able to go back to a healthier state of mind or something like this? So she's gonna struggle for the rest of her life. I think about Andrea Yates never wanting to get out of jail ever. Or sorry, out of not jail, out of the mental health hospital. Andrea Yates says that she's exactly where she belongs. Would Lindsay Clancy do the same? I don't know. I don't know. Let me see. Let me see. Um, somebody mentioned exactly. I was misdiagnosed with bipolar 2 when I actually had ADHD and attentive type. Exactly. So I could see, so the only option I think is either not guilty by reason of insanity. I think it could be I don't know. I don't know what the jury instructions are going to be. Massachusetts is different. So I don't know. Oh, thank you. I would make a great juror in this case. They would have kicked me off as a psychologist because of my profession. my work, I've worked with individuals with postpartum depression. I've worked with individuals with postpartum psychosis. They would have kicked me off because the jury might look to me to be like, explain this to us, because I would want to explain. Wait a minute, is it an intrusive thought, or is it? I would have too many questions, and it would be a hung jury. Because so I don't know how I would vote if I was on the jury in this case. I don't know how I would vote. I wondered if Lindsay Clancy kept drinking after starting medications. I don't know that we have any testimony that she did, but I know that's been thrown around. A 5K is nothing for some people. Exactly, exactly. 5K not competitive, like, and I don't know if it was like for a special cause. I don't know. 5K is like a park run. Yeah. But sometimes you're not supposed to run until you're medically cleared. So I don't think her doctor would have medically cleared her because, after having a after birthing a child, you're supposed to let your body rest. So you're not supposed to run a 5K 1 week after delivering a child. You're not supposed to do that. But because I've worked with clients that were looking forward to that 4 or 6 week appointment where they would be cleared to be able to work out again. I have tried at least 9 different antidepressants over 10 months, unresponsive to medications. Any thoughts? So, in general, I can't give anybody specific medical or treatment advice. In general, um, the person could research treatment options for treatment resistant depression. And then also, if the depression is related to something like grief, is related to something therapy wise, so medication and therapy is often the best combination. And but I have had some clients research TMS, transmagnetic stimulation, where like, and your insurance, you have to talk to your insurance, you have to talk about all those different things. Sometimes you have to get psychological clearance. So I've done psychological testing to see if somebody was an appropriate candidate for TMS. But in general, you'd want to talk about what options were, because there is such thing as treatment resistant depression, and often trying and failing 4 different medications, a person could be determined to have treatment resistant depression. Um, yeah, Zoloft saved my life. Yes. So I work with a lot of clients because mental health is health. And so I've worked with a lot of people that it's really helped. Can a person have a manic episode or mania independent of any medications? Yes. So a person can just have a manic episode in general. That doesn't have to be exacerbated by a medication. Okay. In this case, it does seem like when she started the medication, she started to get worse. But she was kind of worsening all within that time, because when she initially went, because she didn't start the medication immediately, and it seems like things got to the point where she wanted to try medication, but then things like sleep got worse and everything just kind of seemed to get worse. And she was never able to be fully stabilized on a medication. But there is no miracle pill. So, um, uh that's where I would have wanted there to be more, just me personally, I would have wanted there to be more therapy earlier on, because I don't know that there was a ton of therapy before December. A lot of the therapy that we heard of was like, I think, late November into December, but all of this started in September, and it can take somebody 3 4 months to find like an in-network therapist. Ideas as to no doctor recommended she be hospitalized when she was having those thoughts. So, just because somebody is having those thoughts doesn't necessarily mean that they need to be hospitalized. I think the level of distress, but I think so. In those risk assessments, you're trying to see, does the person feel safe? Do they feel like they're going to act on those thoughts? How does their family feel about it? And if in those assessments they're like, hey, like, we just because they recommended that partial hospitalization, they recommended all of these other treatment things. They were just trying to save the inpatient hospitalization for the last possible option. And I think the state might even harp on the fact that she signed herself out of the inpatient stay early. So when she was hospitalized at McLean, that she ended up checking herself out early. And it wasn't against medical advice, because in that moment, to nobody's like nobody, she wasn't an imminent risk to herself or others. And for adults, imminent risk is like in the next 1 to 2 days. It's not in the next week. It's not in the next month. It's like it's within a short period of time. How likely is it that this individual will do this? And so, yeah. All right. Just general thoughts. Do you think Andrea Yates has survivor's guilt? Yes. 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 So she has to live with that for the rest of her life. Yes. 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 Definitely. Definitely survivor's guilt. Um, and her husband has talked in support of Lindsay Clancy. That's yeah, eating issues. I haven't said anything about that related to Lindsay Clancy. My brain just kind of wondered about some of those things. How important is it that a patient agrees with your diagnosis? They don't have to agree. Um, so, and I do therapy. I don't do medication management. So, um, uh, so but if I'm doing psychological testing, um, and there have been people that maybe haven't agreed, where I thought something else better described their symptoms than, but I normally explain my reasoning. And in most situations, people have been receptive to that. There have been some small situations where I think a person was looking for a particular diagnosis, and um, I wanted them to get additional treatment to treat trauma or something first. I am conservative with diagnosis. And what that means is that if somebody is presenting with um, signs of difficulties with attention and focus, but they have a significant trauma history that's never been addressed, I might say, like, hey, let's take a look at this trauma stuff um, before we take a look at executive functioning. Yeah. And sometimes in the chat, people are using acronyms because um, they the algorithm will sometimes eat up certain chats. What do you think about ketamine as a treatment for treatment resistant depression? I think people should discuss that with their medical doctor, along with any of their past risk or potential for substance issues or any of those things. I've had clients do it and find it effective. I've also had some people look if it's legal in their state. So in Washington, D.C., the use of psychedelics for, so it's, what's it? It's like, but it's to do therapy with it. So it's microdosing with a therapist and processing trauma, where, and in Washington, D.C., that is legal. I've had some people look into options like that. And I also think, um, so things like yoga, connecting with your community, connecting with loved ones, so looking at what people are eating, making sure that sleep is okay, looking at the whole person. If people are spiritual, taking a look at them connecting with in healthy ways, if connecting spiritually is a healthy thing for them. So can you read the whole question? Because it goes so quickly, it's hard to know what you're responding to. Thank you. I can do my best. Sometimes I forget. I'm trying to move through quickly. All right. All right. And sometimes I'm avoiding certain words. And what are your thoughts on ECT? So I just saw Paris Jackson, Michael Jackson's daughter, talked about losing, I think, some memories with ECT. ECT is so electric convulsive therapy. It is not my first go to. I would, so, and I don't, because I think a medical doctor has to prescribe it. Um, but if people have tried other things that haven't been effective, they can definitely talk with their doctor about options. Anytime I give an answer like that, read between the lines. Is it wrong to be skeptical with statements for mom, with statements from mom, for example, when statements are being disclosed that weren't disclosed at the time, like hearing her thoughts of harming the kids. So I thought Lindsay Clancy's mom making the statement that Lindsay had thoughts of harming the kids back in early December, that's where I personally was wondering, was this more of an ongoing issue versus a psychotic break that happened in a moment? Or I think the defense would say she was able to fight those thoughts. And then once that psychosis and, that she felt like something took over her body, that's when things went downhill. But, like, all right. Last question, then I'm going to get to a few more notes. Not a question, but I just want to say thank you. This has been the most balanced, civilized discussion and chat I've seen. Yay! I love the psych nerds. Y'all are great. There's been some very one-sided views and not easy to discuss all opinions. And I will support the jury no matter what. Okay? So if the jury said guilty, I see how they could get there. If the jury says not guilty by reason of insanity, I see how the jury could have got there too. Like, this case is just, it's not clear. And then some things came up during Courtroom Confidential of like, how would people feel if she had been at the pool and that voice and she did that to somebody else's child and she did that to somebody else? Like, would people still have, and some people might still have the same thoughts, some people might not. And so is it the fact that it was her own children that she loved? Is that the part that we're really struggling with, when there can be this altruistic filicide that doesn't necessarily have to be a psychotic thing? Um, so let me go ahead and go back to my notes. So the different 5 motives that Dr. Resnick he talked about altruistic filicide, and that's where the incident is committed out of love, not hostility, thinking that this is what is best for the child, that um, believe that the child will be worse if the child remains alive, that Lindsay was obsessed with caring for her children. His words, because that's what the state said. His words was that Lindsay was obsessed with caring for her children and wanted to do what was exactly best for her children. And her children would be in terrible shape, and she would do them a favor by having them go to heaven with her, then remain without her. And so that's where it's like, was that truly psychosis or was that murder? Like, that's where but his definition, and Redding, the attorney, tried to cut him off. Redding tried to cut him off at times. I wonder if Redding was kind of hearing that and like, ooh, I don't know how that's sounding, but it's fine. And then acutely psychotic filicide. That's where a person is psychotic and out of touch with reality. They're acting on psychotic beliefs. He believes she had both. So he believes it was altruistic and acutely psychotic. But if you don't believe the psychosis, could you convict on number 1? He also said child maltreatment. That was not the case here. An unwanted child. That was not the case here. Or spousal revenge. Unfortunately, we just had a case of a mother and grandmother that they harmed the children and themselves out of revenge. Like, they did not want the children to go to the dad. Like, that was horrific, absolutely horrible. And so spousal revenge is another potential reason. And um and so Dr. Resnick described her as a more sophisticated patient, but she was not fully revealing the impulse to harm her children. She had an irrational belief, and I think he called it irrational. I don't know if he called it a delusion. I definitely wrote down irrational belief that her children may be taken from her if, people knew that she was having those kinds of thoughts. No, so that wasn't even cross-examination. That was on direct examination. So then on cross-examination, the state tried to kind of say that Dr. Resnick teaches other psychiatrists how to testify and the do's and don'ts of a deposition. They also talked about how many people will try to resist the voice, and that in her sessions with her providers, even the day before, she denied having any homicidal thoughts. That's thoughts to harm somebody else. And she denies experiencing a voice prior to or after that day. The Commonwealth was unable to interview her until 2.5 years after the incident. Then Dr. Mack. Okay. So he starts with like the McNaughton standard. And if you want to hear more on that, the lawyer did, I think, a great video talking about that. Described her feeling depressed. He described it as situational depression, feeling miserable, not wanting to be alive. Talked about her current medications: Zyprexa, Trazodone, Wellbutrin, Clonidine, and propanol, something like that. Me and names. So she's on something for so Zyprexa, Trazodone is for sleep. Wellbutrin can be for like anxiety. Clonidine is for sleep as well, and then the propranolol is for anxiety. And he mentioned that she's on lower doses of those medications. He did not believe that she had bipolar disorder. He talked about her current stresses. He also mentioned the remorse that she feels, and it was his interpretation that she had remorse. And I don't think the state wants that to come in, but I think it's clear that she has remorse about what she did. And so the state will argue certain things, and I'm just like, y'all aren't like just because the biggest thing is, did she understand that what she was doing was wrong that day? Could she conform her behavior to the law that day? Stick with that. She had been prescribed lithium and did not, so she ended up being switched off that medication. Lithium is typically, haven't seen anybody with bipolar 2 be on lithium. I've only worked with people with bipolar 1 being prescribed lithium. Lithium is one where you do have to get your blood levels checked for how your body is processing the medication and making sure that it's at a therapeutic dose for mood stabilization. And that's normally, in my experience, not a medication doctor, that's been for bipolar 1. He did say for criminal responsibility that yes, she does have a diagnosis that she suffered from major depressive episode as part of a major depressive disorder, and that she had some anxiety, obsessive thinking, possibly generalized anxiety being secondary to the depressive episode. And he denied that there were any manic or hypomanic symptoms. That was Dr. Mack's testimony. He also talked about that psychosis being a lack of reality testing, and that symptoms started 4 months after, because we're talking about the whole postpartum. Oh, people got real mad about this part. So in the DSM versus what the ICD-10. So the ICD-10 is just an international coding. Often insurance companies, so the DSM has F codes and the ICD-10 has so there are different codes. So there are different codes between different things, and I think their ICD-11 is about to come out. I'm almost positive. I've seen that. Like there's some coding stuff that's changing in October that I have to be aware of for insurance purposes. And so ICD-10, it's an international system, uh, but the standard in the United States is normally the DSM when it comes to diagnosis. And the World Health Organization is just a more broader, like it's just a more general thing. And just talking about the postpartum period being up to 1 year or longer. Some people say it's even when a person is still, because sometimes the hormones and things don't normalize or don't go back to pre-pregnancy levels until after a person stops nursing. He went through the details of what she did, and that was horrific to hear. Um, and he says that she retained her capacity to conform her behavior. And so he thought that, yes, she was criminally responsible at the time. For cross examination, it came out that he did not contact any collateral witnesses, but he did review their depositions. He did do all of that. I wonder if the state will come back to that. I do not know. The defense questioned his knowledge of the case. I did think that he gave tentative answers. And the lawyer, pointed that out as well, that he would say, I believe, I think, but I think he was just trying to be very accurate in his testimony, but it made it sound like he wasn't sure. So he would say, like, I believe, I think, I don't know, like sometimes the modifiers that he was using during his testimony, or qualifiers, not modifier, qualifiers he was using, at times it made it sound like he was unsure. And so that's where I don't know if the jury will, who the jury is going to find more credible, or where things are going to fall with the jury. I think the attorney Redding was a bulldog. He was attacking, but this expert, like, is giving some testimony that does not favor his client, and so I think he wanted to make Dr. Mack look less credible with the jury. And so he started throwing these things out, like, so when was she on this and what, like, and to me, I thought Dr. Mack had a pretty thorough understanding, and he was able to answer the questions. The things that he couldn't answer, or that he gave the more tentative answer to, and then by the end, Dr. Mack started giving longer answers that would upset Redding. And so they're just going back and forth. He's trying his best to control his facial expressions. I don't know if the behavior panel will go over the expert's facial expressions, because he was like, you could tell he was using all his skills to manage, because I think he was getting irritated, understandably, but like, it was, they were going back and forth. It was a lot. They also talked about techniques to avoid bias. And I think that might have been where it came out that the two experts evaluated her at the same time, but they're doing different things. So then being in the same room, I think that was to gather the history. And then I think one expert, I'm thinking it's a psychologist. So when I worked on an inpatient unit is different a from like a forensic evaluation. But, and even with, I did do a legal evaluation where we interviewed, it was a social worker and myself, where we interviewed together, because then the person only had to tell the story one time. The social worker did additional testing that was related to a parenting capacity, and I did additional testing that was related to a psychological evaluation. But we gathered the information, the history and everything together. And so Redding made a big deal about it. I was okay with it. But they started talking about the DSM-6, and um Dr. Mack was prepared with with recent data, and saying that postpartum psychosis, that they want it to be its own diagnosis, but it would be, I think, 4 weeks after. And he started going into the research on it, and like, he talked about an article, I think, that was within the last year. I don't think Redding thought he would be that prepared with all of that, and I don't know what the jury's going to do to it. By the end, it just seemed like too, I don't know. Like, it seemed like they were just going back and forth. It was a lot. It was a lot. Thank you all for pointing out that the chaplain said that Lindsay alluded to voices. And I wonder if the state will mention that in their closing. I don't know if they will. But the chaplain definitely said twice that Lindsay alluded. And I don't know if she just used that qualifier. Like, I don't know why she would say alluded. If, because when I hear the word that someone alluded to something, I, but I guess maybe the chaplain might have been using that language because she's not a mental health expert. And so she didn't want to say she told me about psychosis or hallucinations, but the chaplain definitely did use the word alluded. And so it is what it is. Wow. I went way longer than I was planning. I have a whole other video talking about ADHD and autism. So over on my second channel, I'll be doing a video talking about ADHD and autism directly after this video. Um, yeah, because it would be hearsay. She wasn't allowed to quote her. Okay, so maybe she said alluded because she couldn't say what Lindsay told her. I don't, I don't know. But the chat brought up that the chaplain said alluded. So it is what it is. Thank you all so much for being here. I'm Dr. Barry. I'm a licensed clinical psychologist. Here we talk about psychology and true crime. It's my goal to help break mental health stigma. Mental health is a lot. And I hope I mentioned that Dr. Mack is a psychiatrist. And so, yes, so Dr. Mack is a psychiatrist. I believe the state has a psychologist that did some psychological testing. I love psychological testing, and so I'm looking forward to hearing any results of that. But with this case, it is just, there's a lot. Please protect your mental health as you are watching. And when I say protect your mental health, if you start to feel yourself like, like the chat just gets to the point where you're just close the chat. If you're over on Law and Crime, just close the chat. If you're over on Courtroom TV, don't go back and forth with people. Close the chat. That's a general recommendation. I'm not telling you all what to do. I find the chat over on Corgi San. I know she's streaming this. Courtroom Confidential, their trial live channel is streaming this. I know Paul from reporting live from my sofa. I know he's streaming live as well. My next video will be on Tuesday. So Tuesday night about 6 p.m. I'll go live again to talk about this case. Be kind, don't do crimes, and I will see you all next time. Have a good one. Bye.